Hello everyone, it's really nice to see you on my channel, and my name is Elizabeth, and today in this video I wanted to share with you my thoughts and impressions of my first week at work as a pediatric cardiologist. Here should be my stethoscope, but I forgot it at work, so let it be so. Also, I have for you 5 tips how to survive your first days at hospital, whether you're a medical student or resident, because if you are a doctor, maybe these tips will be not really helpful for you. But anyway, watch this video till the end to check them out. To begin with, I graduated from medical school in Russia and my residency was in St. Petersburg. Fun fact that in USA, to become a pediatric cardiologist, you need 3 years of pediatrics and 3 years of fellowship in cardiology. But in Russia, it takes you only 2 years. And I know. Anyway, I worked with the children from birth to 18 years old with congenital heart diseases, arrhythmias, cardiomyopathies, and even treated patients with a heart transplant. 2 years of residency flew by very quickly and it seemed to me not enough. But anyway, I got a paper stating that I'm pediatric cardiologist. After my graduation, we moved from Russia to Kazakhstan, and here I got a job in Center of Perinatology and Pediatric Cardiac Surgery. Who are my patients? Usually they are newborns with congenital heart diseases. When a baby is born and neonatologist suspect some heart defects, here comes we cardiologists, and after echocardiographical examination, if there is no defects and the condition of baby allows, we let them go home. But if there really is some congenital heart disease which requires a longer hospital stay or sometimes several surgeries, we take the baby to intensive care unit. After surgery, the cardiologist also following the baby until he is discharged from the hospital. Such children return to the hospital after 6 or 12 months for diagnostic purposes or correcting the therapy and determination of further tactic. I didn't have so much experience in managing patients with congenital heart diseases, so I'm really grateful that I have senior colleagues who help me with some problems, whom I can ask for any advice. By the way, there are 2 languages in Kazakhstan, Kazakh and Russian, and some of doctors prefer speak Kazakh. And if I'm in the room during conversation, I don't understand even a word, and actually it feels sucks. Nevertheless, I started learning Kazakh, at least to understand what people around me are talking about. In general, staff here is very friendly and kind. Kazakhs love to eat and they are very hospitable. For example, I noticed that if in Russia everyone brought food for lunch for themselves, here in Kazakhstan people bring a lot of food, like a big plate, and they sit together at lunch and sharing the food. And it's like kind of tradition maybe. Most often they cook plov or something meaty, and a few times I was treated with this food and it was delicious. Since I'm a novice doctor, they give me only simple patients who come to the hospital only for examinations and changing treatment, but not for surgery. Most interesting case so far was a 3-year-old boy with a suspected heart defect. Usually we would do a CT scan for such patients, but in this hospital we don't have one, so we went for cardiac catheterization with angiography. And what was my relief when it showed that the boy didn't have a heart defect and everything was really fine with his heart. By the way, I didn't have a lot of patients this week, it was only 5, but I'm okay with this flow because these days I was getting used to my work and department. In my free time, I read some researchers and surgery techniques. Literally on Friday, I spent half of the day looking into some report about technique of one operation, of one surgery, and after that I discussed it with my colleagues, how do they relate it into their practice. It's really great to have some time for it and people to discuss it with. But not everything so simple. I have some problems with the computer program in this hospital. It takes time to get used to this functionality of admission and discharging patients, and also I still don't have all accesses for my work, so it really slowed down the process. At the end of the day, usually we go to ICU or to have rounds on patients there, and every time I'm thinking about how it is difficult to manage patients in such critical conditions. It's a big responsibility, and in my free time I'm trying to read some books and to write notes in my notebook or my notes in the phone, but it's still best to memorize with a practice. No matter how much time I tried to memorize the dosage of drugs, only when I prescribed it for 2-3 patients I started really have it in my memory. So practice makes perfect. In general, it feels like the place where I belong, and I really like the slow pace of my work, that I have time to look into each patient, to read guidelines and literature. And I also want to start doing echocardiography by myself again. In Kazakhstan, as in Russia, the doctor who making echocardiography, he's not a cardiologist, he's just ultrasound doctor. But I would like to do an ultrasound by myself for my patients, because that's how I can create a whole picture of the disease. And here we slowly came to my 5 tips for you. First of all, don't be ashamed to ask anyone for help or advice. Every doctor remember himself or herself at the start of their career, and no one is a genius. Everyone had the same mistakes, and it's better for your patient if you will ask the senior doctor how would be better to treat your patient. If they are good persons, they will be happy to give you advice or help you in any case. But if you will see some judgment or mean remarks, probably there is something wrong about them and not about you. So don't take it close to your heart. Just ask in the next time, ask another doctor or attending. Second tip is have a note with the most common drugs that you use in your sphere. For example, I couldn't have all dosage in my head, so I wrote it the list of them on my phone and in my notebook. So every time when I have the question which dosage should I use, I just look at my phone, and it's okay for me. I don't see anything wrong about it. It's better to treat patient right than feel yourself like a genius doctor and not check yourself. And here we come to a third tip. Find a time, maybe it's 5 minutes a day, to learn something new. For example, you are on rounds and you heard some symptom that you never heard of, or a drug. So you just Google it or write the note to check this drug. And after rounds you have 10 minutes with a cup of coffee, so you can check this drug. With every day of checking some information, you will know more and more. And the fourth tip is to come to the work earlier, a little bit earlier, to check on your patients or their analysis results before morning meeting. Because on these meetings, usually the night team telling about the condition of patients to the morning team. And it would be better if you know about your patients already, which problems did they have, how do they feeling, and which plans do you have for them on this day, so you can share with your thoughts with your team. And the last tip, after working hours, when you're leaving home, try to leave those thoughts about your patients and the treatment at the hospital, because it's important to have work-life balance. And when you come home, just think about the things that you like to do. Maybe cook a dinner or watch a film or do some sport. It's important to have your time for the rest, because next day when you will come to the hospital, it's important to be fresh and with a clear mind, so you can be much more helpful for your patients, whether you will think of them all the time, being nervous, and that's how usually people are burning out. So going back to my experience in the hospital, I think that I will work there for at least 1 year to gain experience. And actually I wanted to show you more on this video, maybe how my day in this hospital goes, but the video will be really long, so maybe I will make another video exactly about 1 day in my schedule, and I can film a little bit more in hospital. To be honest, I'm really wondering, people who are watching this video, are you in medicine or you non-medical, like not in medicine, and just interested in these topics? So please write in the comments whether you medical student or resident, or you don't have any connection with medicine but you're interested in this video. Maybe you have some questions about my department, my career, my plans. I would be really glad to answer it. And this is all. Thank you for watching this video. For me, today is Sunday and we are going for ice skating in the mountains. I'm very excited about it. I hope that you're having a great day too. Hope to see you soon. Bye.